Feels really good, right? We're going after cranial nerves now, so any sort of just tension in the body, suboccipitals, this is really good for kind of getting that fight or flight, sympathetic to calm down, parasympathetic to turn on. We can take fingers and kind of walk like a piano on the bottom side of the chin and get all of those different muscles that are inserting from the hyoid onto the mandible and hooking back deep in here. We could use a flat fingertip, depending on what finger you might have to use and the patient's size, it might vary, but if you can get on the anterior TP of C1, you can push now down on it. So in this case, I'm kind of hooking into the side of the TP, I'm on the front part of the TP and then I'm pressing down. So I'm almost like doing a left rotation motion palpation with my fingertip, but just holding very gentle pressure and tapping it, and to see it on this side, finding that TP of C1, getting on the anterior aspect of it, and then pushing posteriorly. Just very flat, very gentle pressure. Almost like I'm not even using enough pressure to play a piano key on like a weighted keyboard. Holding pressure there. Then a move I really like that a massage therapist once showed me is to walk your fingers on the upper part of the masseter insertions. Find if there's any tender points, hold, and when you find a spot you hold, say gently open your mouth as wide as you can go without any pain. Wider, wider, wider. Yeah, there you go. And you can pin as they stretch their masseter open and relax. And let's find another spot, good hold there, open, 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 and relax. And then lastly, I don't know why this feels really good too, something about where the fascia is inserting on top of that. You could work around the eyebrows, right? You could work around the mouth, depending on what the patient's comfortable with and what kind of complaint they're dealing with. If they have a lot of facial tension, jaw tension. But the last thing I like to do is with flat fingertips, just walk along the top part of the scalp where all that frontalis fibers are going in, meeting with suboccipital fibers on the back, and just kind of walking, pressing into the top of the scalp. Kind of feeling for where the fascia feels maybe a little tight, maybe holding my thumb on a point there. At this point, if you did want to do TMJ work, throw a glove on. You can go internally and get the pterygoids are the main ones I go after. Coracoid process I do a little bit, but definitely stripping the masseter and then going after lateral pterygoids. Sometimes I do medial pterygoid, but I find I can just use my fingers and hook underneath and get it externally without having to go internal and way deep at the back of their jaw. But if I was going to do lateral pterygoid, how it would look is I would go inward and I would take my time getting to it. I might have to have the patient wiggle their jaw very gently left and right to kind of open it up a little bit. And then as I get on it, then I'll just nudge and hold pressure there. Not enough to make them flinch and pull away, but just enough to feel it start to release. And then I would do that on the other side.